مسك الختام الصديق العزيز الحنون دكتور احمد شامة هيكلمنا على جيم تشينجر ليفت جراست. اتفضل يا دكتور احمد.
Hello, everybody. I'd like to thank Eva Farm for inviting me to give this talk. Good evening, and today I'll be discussing the lift grast, marketed as Lacry Lift. I'm going to discuss its role in managing dry eye. Dry eye is one of the most common conditions that we encounter in our practice. It does affect the quality of life of our patients. The disease itself and the mechanism of action of the lift grast will be discussed in this next slides. As we know, the new definition of the dry eye disease is not just insufficiency of the tear film. According to the DIOS-3 definition, dry eye disease is a multifactorial condition characterized by loss of tear film homeostasis. The disease involves tear film instability, hyperosmolarity, inflammation of the ocular surface, and damage of the neurosensory part. This updated definition emphasizes that the dry eye is not simply lack of tear film, but rather a complex disease process involving multiple mechanisms, particularly inflammation. The Liftigrast is a novel anti-inflammatory eye drops approved by the FDA since 2016, for the treatment of both the signs and symptoms of dry eye. We were waiting for this novel molecule to come to Egypt, and finally we got this in our hands now. Unlike artificial tears that mainly provide temporary lubrication of the eye, Liftigrast targets one of the key inflammatory pathways involved in dry eye. This makes it an important therapeutic option for patients with chronic inflammatory dry eye disease. Patients with dry eye commonly complain of blurring of vision, irritation, foreign body sensation, and sensitivity to light. Interestingly, symptoms often fluctuate throughout the day. Some patients may suffer in the morning while waking in the morning, while others may suffer after using the computer for some time. The exposure of the air conditions and things like that may make them suffer more. Understanding these symptoms is important because they directly impact the comfort and the quality of life of our patients. One important concept in dry eye diagnosis is that both symptoms and signs and clinical signs should be present. Sometimes patients have severe symptoms but minimal staining or clinical findings in their eyes. This may indicate neuropathic corneal pain, often called pain without stain. If you find your patient having no signs, but he's complaining a lot, think of that. However, some other patients may have signs with no severe symptoms. This condition, that suggests neurotrophic keratopathy, and therefore a comprehensive evaluation is essential. This slide shows the key mechanism behind Liftigrast. In dry eye disease, inflammation plays a central role. Liftigrast specifically targets the interaction between lymphocyte function associated antigen and the ICAM, which is the intercellular adhesion molecule that is present in inflammatory condition of the dry eye. By blocking this interaction, liftigrast interrupts the inflammatory cascade from the beginning that contributes to ocular surface damage and the vicious circle that we find. Dry eye, inflammation, more dry eye, more inflammation. When the ocular surface is stressed, ICAM1 expression increases. By the way, ICAM is present in very little amounts in normal cornea, but in inflammatory conditions, it increases a lot. This will promote the T cell migration and activation, leading to the release of inflammatory cytokines. And we know that inflammation with cytokines is the big problem in dry eye. These cytokines further damage the ocular surface and perpetuate the cycle of dry eye disease. So liftigrast blocks the LFA1 ICAM1 interaction, reducing the T cell activity and inflammation, thereby helping restore ocular surface health. This diagram emphasizes and summarizes the role of liftigrast within the inflammatory pathway, rather than simply lubricating the eye. Liftigrast acts upstream by preventing inflammation or inflammatory cell recruitment and activation. This targeted mechanism makes it particularly useful in patients in those dry eye symptoms are driven by inflammation. Liftigrast was the first FDA-approved medication specifically indicated for both the signs and symptoms of dry eye disease. It has high aqueous solubility, and this is very important. So the concentration in the cornea is rapidly high. Rapid absorption into ocular tissue and rapid systemic elimination. Clinical trials demonstrated significant improvement in dry eye symptoms and signs, with some patients experiencing relief as early as 2 weeks. And this is very important in liftigrast. We expect rapid relief of symptoms within 2 weeks. Recent studies also have shown additional benefits of liftigrast beyond symptom control. Patients may become less dependent on the artificial tears. Studies in the meibomian gland dysfunction demonstrated also improvement in dryness. So it can work in both evaporative and lack of liquid in Sika syndrome. Furthermore, patients undergoing cataract surgery showed better ocular surface optimization and more accurate biometry measurements after treatment with liftigrast. And this is very important for us as cataract surgeons. The liftigrast 5% ophthalmic solution is indicated for the treatment of both the sign and symptoms of dry eye disease. The recommended dosage is 1 drop in each eye every 12 hours. And if the patients stick to this regimen, they will benefit most of this drug. If the patient is wearing contact lens, he should remove the contact lens before instilling the eye drops, and he can put it back after 15 minutes of installation. The phase 1/3 trial demonstrated significant improvement in both objective signs and subjective symptoms of dry eye disease. Patients treated with liftigrast showed reduction in corneal fluorescein staining and conjunctival staining, along with improvement in ocular discomfort and dryness compared to the placebo. These findings established that the liftigrast is an effective treatment option for dry eye. And it's very important to address the safety of the molecule. The safety is an important consideration for any chronic use of any drug. A one-year multi-center study found that liftigrast was generally safe and well tolerated. No unexpected adverse events were observed and no serious ocular safety concerns were reported. This favorable safety profile supports its long-term use in patients with chronic dry eye disease. As we all know, there is other anti-inflammatory products in the market. Both liftigrast and cyclosporin are anti-inflammatory treatments for dry eye disease, but they differ in several aspects. The liftigrast works extracellularly, unlike the cyclosporin, which is an intracellular medication. It acts by blocking the LFA1 and ICAM interaction, while cyclosporin works intracellularly by inhibiting calcineurin. One major advantage of the liftigrast is its faster onset of action, unlike the other, which may take up to 6 weeks to act. Improvement, the signs and symptoms and the improvement occur more rapidly with the liftigrast. The cyclosporin may require several months before full benefit are achieved. This difference can be important when selecting therapy for very symptomatic patients. In conclusion, dry eye disease is a complex inflammatory condition, and liftigrast offer a targeted approach to treatment. By interrupting the LFA-ICAM pathway, it reduces inflammation and improves both signs and symptoms of the disease. It is relatively rapid in onset of action, favorable safety profile, and proven efficacy that make it a valuable addition in our therapeutic options. The only thing that you have to tell your patient about is some taste that he may suffer from, and he can drink orange or anything like that to remove this taste that occur in some of the patients taking the medication. I'd like to thank Eva again, because they are bringing to us the things that we ask for. And I was telling my patients to bring this medication from Emirates, and it costs them a lot of money. And now we have this medication in our hands. So I'd like to thank them so much. And thank you very much.
Thank you, Dr. Ahmed, for this very nice